Hi, everyone. I'm especially excited to welcome you to tonight's webinar, CPARF 2022 and Beyond, featuring our Executive Director, Michael Perlmutter. I'm Jocelyn Cohen, Vice President of Communications and Engagement with Cerebral Palsy Alliance Research Foundation. This webinar is closed caption enabled and I've turned on transcription. For additional accessibility, I'll share a visual description of myself and Michael. I'm a white woman with dark brown shoulder-length hair that's down and brown eyes. I'm wearing a bright pink sweater. Sometimes I may look like my eyes are looking away from the screen or like they're rolling, but that's just part of my cerebral palsy. Michael is a bald white man with brown eyes and brown facial hair. He's wearing a dark sweater with a white collared shirt underneath. I've been at CPARF for more than 3 years, and I was drawn to work here because I'm a storyteller at heart, because I love writing, and because I could think of no better place to use my skills than to move cerebral palsy research forward. When I first arrived, I studied up on the research areas that we fund: early detection and early intervention, chronic pain, technology, genomics, and regenerative medicine. We were laser focused on research, and I really liked that. The more we could learn about this disability that I share with 18 million people worldwide, the better. I also put realistic expectations around our work. Research, by its nature, is a slow, deliberate process. It's meticulous and it happens in phases. It takes years to get results and often more than a decade for those results to make it into the world. But it was and is worth it and worthy to me, because even if it won't help me now, it could help me in my 60s or 70s. And if it doesn't ever help me, that's okay too, because there are millions of younger adults, teens, kids, babies, and future generations coming up behind me, and they deserve the state-of-the-art science we fund. In my conversation with our executive director and my friend Michael tonight, we'll talk a little bit about how we got where we are, but we'll focus on where we're going beyond research, and it's so exciting for both of us. So Michael, before we get into that, can you share why you were drawn to working at CPARF?
Absolutely. And thank you, Joss, for letting me be a part of this conversation. And thank you to everybody who's joining us tonight. I'm grateful to be a part of your community, and I appreciate everything that everybody's done to accept me as part of it. The reason I'm passionate about this is both professional and personal. I joined this organization from the Partnership for Clean Competition, an organization that does anti-doping research around the world, that when I started did about 15% of the world's anti-doping research. And I'm very proud to say 8 years later, did more than 80% of the world's research in anti-doping. And so I looked at CPARF and I said, this is a place that I can absolutely make a difference. And then it became personal for me. My wife was pregnant at the time. Her mother is actually listening or watching this webinar right now, so I apologize in advance for telling this story. But she was told by a doctor she was called a geriatric pregnancy, or told she was of advanced maternal age because she was over 35 and having her first kid. And she was a high-risk pregnancy because I'm now the proud father of twins. And so every doctor, when we met with them every single week, told us that our children were going to be born prematurely, that they were going to be born with low birth weight, and that they had a risk of a number of different disabilities, diseases, or conditions, one of which was cerebral palsy. And so I did all of this research learning about CP because I thought I might have a child or two children with CP. At the same time, for those of you that know me, you know that I served in the military for a number of years. And when I was 22, I acquired a chronic pain condition that still affects me to this day. And so when I was talking to Jocelyn during the interview process, I realized that we had so much in common, from the Lyme disease that affects my knees, ankles, and joints every single day, to the chronic pain that's part of her CP journey and affects more than 75% of the people who have cerebral palsy. And so when people say, I joined this job because of, I had professional experience that was relevant, I tell them that it's also very, very personal to me.
I appreciate that. And I remember when you shared that with me, and I remember forming a bond with you at that time. So it's one of the reasons why I'm proud to call you a colleague and a friend. In my own life as an adult with CP and as someone with lots of adult friends who have CP, I can share it's a common experience to barriers and challenges to care. And I know that research is so important. Research is, as I mentioned earlier, a lengthy process. So what is CPARF doing to bridge the gap between what people with CP need now and what research is addressing in the future?
It's a great question. I want to start by saying that researchers are absolutely doing critical work in this field. There are so many questions that we still don't know the answer to, and CPARF is committed to just growing our research base, to making sure that these unanswered questions develop answers. But our goal can't just be to publish research results. It has to be to speed up the process and increase the standard of care for people today who have cerebral palsy. It also has to be to make sure that proven interventions that are used in academic teaching hospitals in large cities in the United States, or for example, in Australia, where I just visited to meet with the Cerebral Palsy Alliance, are available at every interaction, at every medical clinic, and at every hospital around this country. And that's why we're expanding the work that we do. We're absolutely going to retain our focus on research, but we're going to add a focus on innovation and implementation to bring what's already been discovered by these amazing researchers and these amazing clinicians to be available, affordable, and accessible for every person that has CP and their entire network. We're going to bring these results to real life because ultimately, we measure ourselves by the impact we have on the CP community and not on the number of papers we publish. And that's my first announcement for tonight. In order to show that this is a priority for our organization, you have to resource something as a priority. And so we have recently, or I'm announcing right now, the formation of the Senior Vice President of Innovation and Implementation position at CPARF. This person will be focused on bringing the actual research to life, on bringing these proven interventions to market in medical clinic, in every hospital, without barriers of cost or access or race in some cases. And some of you may know the person who is initially going to fill this position, a person who is near and dear to both the CPARF heart and to the CPA in Australia heart, Chris Olver, my predecessor as executive director at the Cerebral Palsy Alliance Research Foundation, my friend who is joining us back from Australia in just a few weeks.
I am so thrilled to have Chris back on the team and to expand into this new realm. You talked a bit about the implementation that we're starting. What can you share about the innovation side?
So everybody knows that there are companies today that are meeting the needs of the CP community. And there are even more startups than are in the pipeline that have the ability to do this in the next couple of years. And we have a responsibility, if we're truly dedicated to meeting the needs of the CP community, to amplify, support, and in some cases even fund that work. And so we're identifying and connecting those companies. And that's what leads me to my second big announcement tonight. We are launching Remarkable US in partnership with Remarkable, a transformative Australia-based startup accelerator made possible by our partners at Cerebral Palsy Alliance. Since 2016, nearly 50 startup companies have come through the Remarkable Accelerator and raised more than $28 million to power up the potential of people with disabilities all over the world. Remarkable's 16-week accelerator equips early-stage startups with seed funding and the necessary knowledge, skills, and tools to become commercially viable businesses, making a positive impact on the disability community. Remarkable also embraces the crucial disability rights concept of nothing about us without us through its partnership with Open Inclusion, a global organization that provides user test experiences with people with disabilities to identify practical innovations that improve users' experience, running accessibility audits, and hosting educational workshops to help educate startups about open inclusion. Simply put, Remarkable brings innovation to the market faster, with a focus on affordability, accessibility, and practicality for the disability community, including each and every one of the stakeholders that's on this call. Remarkable's 2022 cohort features 8 startup organizations, 3 US-based, 4 Australian-based, and 1 based in the United Kingdom. I can't tell you what these companies are yet, because we'll talk about that in next month's webinar when Jocelyn interviews Pete Horsley, the founder of Remarkable. But I can tell you we're tremendously excited about the opportunities that they will bring today and tomorrow for members of the disability community, addressing some of the most urgent and pressing problems that each of you face: affordable solutions to mobility, communications, technology, and many other accessibility issues will be addressed by the startup organizations that are part of this cohort. And it'll only grow from there.
Am I right in saying that several of the startups that Remarkable has funded in the past are founded and led by people with disabilities as well?
You are indeed correct. It's another way that they live the nothing about us without us philosophy, by having entrepreneurs with disabilities help meet the needs of their own community. And it's so important that we embrace entrepreneurs from varied backgrounds, including disabled entrepreneurs.
Right, because they're the ones, and we're the ones, I'm not an entrepreneur, so they're the ones, living and finding the gaps. And I often say that people with CP and other disabilities are masters of adaptation. And so Remarkable is really bringing those things to life and into reality. I'm really excited to see where this goes and to host that webinar with Pete next month. So,
yeah, I'm excited to watch it.
I mean, I love Pete, and whoever's on this webinar should join us for the webinar with Pete too. He is a fantastic storyteller, and the history of Remarkable and where it's going is really something to behold. Of all these new initiatives, we've talked about a lot already in a relatively short amount of time. Of all the new initiatives we've talked about and the possibilities you've spoken about so far tonight, what are you most energized by and why?
So this is like asking me which one of my kids I love the best. The answer is actually pretty straightforward. We need to meet the needs of the CP community across every age and every stage. And we don't need to meet it in 15 or 17 years when some of this early stage research would be completed and put into practice. We need to meet it today and tomorrow. And some of the best parts of my job, since I've started just 10 months ago, has been meeting with people in the CP community, whether it be people with CP, their caregivers, their family, practitioners in the space, medical doctors, researchers, etc. And the only consistent story of the CP community is that they don't care what the methodology is that brings these solutions to market. What they care are that the solutions are available, they're accessible, and they're affordable. And that's what we're going to do. We're going to provide the help today, tomorrow, and the research that will change people's lives over time. And so I'm excited to figure out new and innovative ways to help bring solutions to the people who urgently need them. As I talked about a little bit before, I've had my own run-ins with the medical system through my bout with Lyme disease. I had to navigate a system that also was not set up for me. And to have all the fights that people in the CP community are having every single day with insurance companies, with providers who don't know the most up-to-date treatments, with caregivers. And my job as the executive director of the Cerebral Palsy Alliance Research Foundation, and all of our jobs, are to make that fight just a little bit easier, to make the system work for you in a way that it never has, and to make sure that the solutions that you desperately need are available to you. We absolutely hear you, but we're not just listening because we want to hear your stories. We're listening because we want to make a difference. So in order to help people with CP at every age and every stage, We need to approach our research obligations, our innovation, and our implementation from every possible angle, because the story isn't about the publication, although that's important. The story is about the person with CP whose life is just a little bit better because they have technology available because of a startup that we funded and incubated through the remarkable US program, or it's just a little bit better because the standard of care is now the same throughout our medical system. And that is the commitment we're making to you today and every day in the future.
You touched on this a little bit at the end of the answer that you just gave. Where do you see opportunities for implementation?
So I just spent 17 days studying the Australian system and the things that are available at Cerebral Palsy Alliance in Australia. And I can tell you that there are mobility solutions, communication solutions, there's knowledge about CP and aging, there's giving the best possible prenatal care to every mother and child, whether they're in Manhattan, where I'm speaking from today, or they're in Manhattan, Kansas, thousands of miles away. We are working with our scientific advisory board, a collection of minds from throughout the world that have unparalleled scientific expertise, which we will continue to expand as we expand our mission to meet the needs of the CP community at every age and every stage. And through their work and through our work, we have the ability to change what the world is like for people with CP, their caregivers, their community, and how each and every one of us interact with the healthcare system.
As an adult with CP, and someone who's had many conversations with you about this, I really appreciate this side that we're expanding into. There are so many needless barriers, and if we can help knock them down one by one, the more we can do, the better. So I'm really thrilled that we're taking this on. And as we do this additional work, we're going to have even more ways to share it with people. The webinars we're doing will be monthly. As Michael and I mentioned earlier, our next one is in April, late April, with the founder of Remarkable. We're starting a podcast in the next few months that will highlight people with CP and the ways that innovation and technology have made a difference for them. And so there's all these great things happening. How can people jump in and help if they want to?
Sure. So I think there's a couple different ways for people to join in and help. The first thing I think is absolutely obvious. Whether you're here right now listening to this webinar live or viewing later on, I want you to be part of the conversation. Make your voice heard. So if there are things in science, technology, innovation, and implementation that you think are lacking in the cerebral palsy ecosystem, bring it to our attention. There may be an opportunity for us to fund some research or to put it in one of our future projects in the innovation and implementation, or to even fund a startup that's working in the space. This is an ongoing dialogue. I'm actually going to visit a school tomorrow in Philadelphia, where I'm going to meet some wonderful students who have cerebral palsy and talk a little bit to them about their lived experiences. And so I try and continue this dialogue every single day. And so please reach out to Jocelyn or myself, because we'd love to have you be a part of the conversation. Obviously, I'd love to see you get involved with CPARF as well, whether it be financially through supporting our organization or just part of these conversations. Either way, please come to the table, because this can't happen successfully without you. Before I stop talking and turn it over to questions, I'd love to just tell every person who's listening that this is the beginning, not the end. These are the new ways that we're going to help people in the CP community today, tomorrow, and forever, but it won't be the end of our journey. We will continue to expand the ways that we serve the CP community until all of those needs in the science, research, innovation, and implementation area are met. And with that, I'm happy to take any questions that anybody has.
So someone submitted a question when they registered that really dovetails nicely with what you just said, which is, where do you see CPARF in 5 years?
So I think that the answer to that is obviously multifaceted. I see us running remarkable programs, full cohorts of 8 to 10 organizations every single year, just in the United States, to go along with the international cohort that'll be run by Cerebral Palsy Alliance in Australia. I see us funding maybe 3 or 4 times the research that we currently fund. And I see us focusing on very practical implementation options that would make a huge difference to the 18 million people around the world with CP and the people in the United States. But in order to do that, we have to do more of everything. We have to grow as an organization because consistently throughout these conversations, people bring new research topics, new innovation ideas, new implementation strategies, and we haven't traditionally been able to address them all. And so it's tasked on our staff and our supporters to help grow us to be the organization that meets all of these needs. And I promise you this, we have 15 people that work for the organization, and none of us will rest until that moment happens. And we probably won't even rest then. And so please, I would love to see us grow. I would love to see us meet these needs. And I would love to see us support more research, more innovation, and more implementation in the community. So please do what you can to reach out and engage in that dialogue.
I'll just echo what Michael said. You know, I'm one person with CP. Michael's spoken with other people with CP. I have a friend and colleague on our staff who has CP. But the more people we can hear from, the more stories that illuminate needs that we can help meet or alleviate or work around, the better, because CP is such a diverse disability. It presents differently in each person, and people have different co-occurring conditions and need different adaptations and different things to help them out. So everyone's opinion and experience is valid and worth knowing. And if you see something highlighted that you either experience, or if this conversation is bringing something to your top of mind that you want to share that you think could be helpful in the areas Michael's been talking about, please reach out to either one of us or both of us, and we'll see what we can do. You know, we're small but mighty, and we're trying to grow as much as we can. And Michael, at the end of your last answer, you again mentioned implementation. For people who might not understand fully what that means, can you share some more specifics around implementation and the practicalities of it, especially what it means in the US, in our healthcare system?
I mean, I've talked about some consistencies in the conversations I've had with the CP community. And one of those consistencies is that the medical system in the United States is not meeting those needs, right? People are struggling with insurance companies to get things covered. People are struggling with practitioners to make sure that solutions that they've become aware of that are evidence-based are not available to them if they live in the wrong geography or getting therapy at the wrong hospital or whatever the case may be. So think about implementation like this. If there's a best practice in CP medicine that's evidence-based and data-driven, that's available any place in the world, it should be available every place in the world. And so this is making sure that if you go to NYU or you go to a random hospital in the middle of Colorado, like where my children were born, you should receive the same information, you should receive the same medical care, and you should have the same treatment options available. Whether you're a pregnant woman in a high-risk pregnancy like my wife was, or you're a person with CP who's just seeking out the best possible therapies. And the solution to that problem is multifaceted, right? We need to get new research that will crack the code of some of the questions that we still have, that maybe we're a research project and then an implementation project away from seeing in the market, being able to go to your practitioner and ask for it. But there are also interventions that are already scientifically proven, that have a robust scientific basis in the literature, that are data-driven, and that are available only in some locations. You know, I talk about it just coming back from Australia and hearing some of the interventions that are available to pregnant women in high-risk pregnancies over there. But it's just as true in New York City for interventions that are not available in rural America. And so we need to do better. We need to make sure that all of that knowledge of those treatments are translated so that they're available throughout the healthcare system in the United States.
I have thought often as someone who was born in New York State about what my experience is like and how it differed from my friend who was born in Kansas with CP, and the way doctors spoke about it at the time that influenced perhaps the way her parents spoke about it to her versus my friend who was born in an Atlanta suburb with CP, and the way that the care that they received impacted how they grew up and what they thought of their CP and what therapies they received. So it's something I've thought about a lot in my own life, and I'm so happy that we're taking it on in the ways that we can. So one of the things that energizes me about what we're doing is that I see 3 parallel paths. And as you mentioned, we're not forsaking research for anything else. So the paths are research, tech/innovation, and implementation. Do you see opportunities for these paths to intersect, for implementation to intersect specifically with research and innovation and all the way through?
Absolutely. I mean, you see a world where we could take something literally from the smallest of idea, fund a researcher to do the initial preliminary research just to prove that that's scientifically viable, and then a further study, potentially even fund them going through a small FDA trial. And then after that trial completes, moving from the paper to the practice by facilitating the implementation of whatever that specific technology or treatment or protocol may be. And then potentially even funding a startup that's working in that space. And so I prefer not to think of these as like disparate activities. These aren't independent things. We're hoping that our research flow will flow into our implementation work. We're hoping that we'll be able to invest and support startups that are also focused on those same efforts. And so to me, this is research plus. It's not 3 different things. It's just we can't accept anything making it to publication, but not to practice. And we need to spend just as much time, effort, and resources to make sure that it ultimately makes an impact on people with CP in the community, which is the reason why all of us work for this organization and why many of us work in this field.
I mean, it's really like a relay race, and the researchers are the super important first leg of the race, and just passing the baton as you go. Getting it published is the end of one phase and should be the beginning of the next leg of the race. And
by the way, just as an aside, the researchers want to see it implemented as well.
Yeah.
I mean, I talk to researchers in this community, multiple times a week, and they're just as impatient, right? They're not doing this research because they want to publish. They're doing this research because they want it to affect change. And so the researchers are totally on board with this effort. They want to see the results, the things that they've learned, the questions that they've answered actually be put into practice. And so some of our biggest champions for the implementation and innovation work are researchers who want to see their research come to fruition.
I appreciate that. That perspective on it.
Some of which are actually on this webinar right now. So I very thank you for the research that you do, and thank you for being so dedicated to making a difference in the lives of people with CP.
Yeah. Somewhat related to that, someone asked a question in the Q&A. How do you envision engaging the government and public organizations like the NIH and CDC to accelerate the CP agenda?
So it's an excellent question, and one that's actually quite timely, because I think I saw a press release from one of our friend organizations, the Cerebral Palsy Foundation, today about a bill that was introduced in Congress to fund scientific research that was sponsored by Stephen Cohen from Tennessee. I think no relation to you guys. I think the answer is both and, right? So the government should fund more CP research. I think there's nobody on this call or nobody on this webinar who would disagree with that statement. Probably nobody in the CP community who would say that the government is funding enough CP research in the space. But we're a private foundation, and our goal is to, if the government isn't doing enough to address the needs of the CP community, our goal is to do the rest, right? To make sure that the shortfall in government funding does not mean a shortfall in CP research. And so we're committed to working with our partners to help that agenda move forward. But at the same time, we're not waiting for it. We're not going to wait for Congress or the US federal government to get their act together and fund the necessary CP research to meet the needs of the community. We're going to fund that today. And we're not going to stop with that research. We're going to move into the implementation phase. So the insurance providers, the medical providers, and the hospitals all get on board with the necessary interventions that treat, using evidence-based, data-driven interventions, treat people with CP at every age and at every stage. And so I think it's a great question, and I'd love to wake up tomorrow and see the government investing 10 times what they currently invest. But I'm not going to lose sleep over it, because we're going to make up that difference by investing more in research, more in innovation, and more in implementation.
Thank you for that. I have a question on kind of a different note about some of the research that we're currently funding. So someone in the Q&A said, I'm a mom to a 3-year-old boy with CP. Can you talk about some specific therapies, treatments, or trials you're funding and you think show promise for gross motor improvement? For example, eSIM, vibration therapy, and intensive therapy. I mean, one thing that comes to mind is we're currently funding something with Trexo Robotics to see if exoskeleton robotic assisted physical therapy is more beneficial to increasing gross motor in kids with CP. And I think I'm oversimplifying it, but more information is available about it on our website, and Michael may remember more information than I just stated.
Yeah, so I'm going to answer this in a couple ways. So first of all, thank you. I love answering questions about research. We are a research funding organization, and it's wonderful to get to talk about the research. So I'm going to say 2 things, one of which is going to be a teaser, and the other which is going to be a scientific paper that I think you should go read. And the first one is, I think you're going to find that a number of projects that we're investing in, either through the Remarkable program or grants that we're going to put out this year, will address movement, specifically in young populations. And so I encourage you, I literally can't tell you what the companies that are going through Remarkable are, or the company that I'm talking about this grant yet. But I can promise you that there's at least 2 projects in the works for this year that will address that. And if you reach out to me after the webinar, I'm happy to share that with you. The second answer is, I would encourage you to read Iona Novak's 2020 paper on the state of the literature in the space. They have a whole section dedicated to things that affect gross motor function, and talk about the areas of improvement, the therapies, the treatments, the trials that have the most scientific validation. It's referred to as the stoplight paper because it gives a red, yellow, and green recommendation. Green meaning that it's a solid evidence-based intervention, and red meaning don't do this. And I'd encourage you to go out and read that paper, or at least to look at the interventions that are most evidence-based in the specific area of CP. And I'm happy to share that with you offline and talk through it, and potentially even set up a call with Iona and myself. She serves on our scientific advisory board also. So she's helping us craft this innovation and implementation strategy as part of our SAB.
Iona and our whole scientific advisory board is a real group of powerhouse women. So thrilled that we were able to get them together this year and help, guide the research that we fund. Related to that, and some of the questions that you've already answered. Someone submitted the following question: what is one of the biggest challenges for people living with CP that CPARF is hoping to help address the research and innovation in 2022? It's a big question, so I don't know if you're able to pick one, but I'll leave you to it for now.
I mean, so I think that there are a number of different answers. I mean, if you're looking for something, a research project that's going to end in 2022, I'm really excited. I think we had Dr. Zach Vasulis on a previous version of this webinar where he talked about the continuous oxygen monitoring technology for kids in the first 72 hours of their life. This has the potential to reduce oxygen-related deficits in the brain by up to 25%. It's a very tangible, very practical thing that is a benefit over pulse ox that is done generally by, the thing that they put on your finger when you go to the doctor's office. And so this is both continuous and directly monitoring of the oxygen level in the brain. I mean, if you're talking about more meta and more long-term, I think, as my friend Jocelyn will tell me, part of the issue with the medical system in the United States is that it wasn't set up for people with CP. It was not set up for people who consume a various number of different treatments and therapies, who have many different doctors of different types, and those doctors have to talk to each other and interact in ways that the system is not set up to support. I think for the long term, we're interested in making that system friendlier to people with CP by creating new and innovative ways to meet those needs, whether they be through technology, whether they be through the combination of two types of therapy, like a robotic brace therapy with a spinal modulation therapy. I mean, there are all kinds of opportunities to get entrepreneurs, whether they be in the private sector, or implementers, whether they be at the hospital, to work together much more effectively than they're currently working together. And so maybe over the long term, maybe through this work, we can make a system that's built for everybody and not just for healthy people or people who don't have complicated medical cases, of which I am not one of those people. My medical history would say otherwise.
Yeah, I hope so. I mean, it's one of those things also as people age. I mean, I've had CP since day one, essentially, of my life. But as people age, things happen to you, you acquire things. And so, to help ease burdens within the healthcare system for people with CP will have great follow-on effects, because it's easing the burdens for people that need the system later on in their life. And, how much time and energy does a 75 or 80-year-old have to fight with Medicare on the phone, to fight with their hospitals and their multiple specialists? You kind of necessarily have multiple specialists when you're older. So the hope is also, super big picture, decades down the line, that some of what we're doing can help the healthcare system in general and help people, outside of the CP and disability sphere, because a rising tide lifts all boats. And the accessibility that was gained when the ADA was implemented, and, for example, curb cuts were put into cities and places, yes, of course, that was for people in wheelchairs, but then parents with strollers, people wheeling luggage, anyone doing deliveries, all benefited from it. And so hopefully that will be the case here.
And we see it already through some of the entrepreneurs that we're supporting through Remarkable, right? Like they set out to address the needs of a specific component of the disability community, but they address the needs of so much more. And it's those unintended effects where you can, like you said, a rising tide lifts all boats, where you can help the entire system, right? We've been talking internally about one of the organizations that we're supporting, and it helps people with CP, but it also helps people with visual impairment. It also helps people like me who can't navigate the city of New York without tripping over a curb, right? It helps people in so many meaningful ways that we're able to make a huge difference just through the ripples that we create by supporting these entrepreneurs. And I'm excited to see those ripples. I'm excited to see the difference that we can make as an organization. And I think the people that have been champions for CPARF for our entire existence will be really excited to see this direction take shape.
Me too. I have a question that's not necessarily related to our work, but I still think is an important question to put out there because it's something that disabled people have to deal with a lot. Someone asked in the Q&A, what can you do if university healthcare and the school that you're going to won't make the areas you need to go to more ADA accessible? And I know we can't answer that directly as a research organization. It's not really our main lane, but just having experience with my college and graduate school's offices of disability services, I wanted to say, I know how frustrating that is. For example, I went to a school in the Midwest and they did not salt their sidewalks at all. And no one really answered that concern. And I was surprised that no one answered that concern because to our earlier point, like ice is a problem for everyone. It's not just a problem for people with CP. It's a bigger problem for people with CP, but it's a problem for everyone. And the way that I dealt with that was having a strong support network around me. One of my friends got a bag of rock salt, salted a path to my car, and we sort of claimed that parking space as mine. And I spoke with the people inside my grad school and they got things salted. But going to the main offices, the more bureaucratic places, I did not have much success with that. So my informal advice that I hope is helpful is to engage people that are allies for you to take some of the emotional burden off of you and help in the smaller ways that are helpful to you, and maybe take on some of those arguments for you. Because I know when you have to fight a housing department because they won't give you what you deem accessible housing, or they won't put the women's bathroom close to your room, when you have to walk down a long hallway in flip-flops and a bathrobe and carry a shower basket, having to have that conversation multiple times is really draining and exhausting and upsetting. So as much as you can fortify and grow the network of friends and allies and people around you who can help you take on those conversations and needless fights, but fights nonetheless, that's the easiest thing you can do. I mean, there's like bigger scale stuff. They really should be paying attention to the Americans with Disabilities Act. So I would certainly go to the administration and the offices of disability services or the equivalent. But having that strong network around you is going to make it a little less burdensome on you. And I hope that you have that around you. So I know that was a little far afield, but I hope that it's helpful to the person who asked the question, and perhaps other people who are watching or listening to this, to know that you're not alone. Unfortunately, you're not alone in the sense that this experience has happened for decades and decades and is still happening to you, but you're not alone in the sense that there is a community around to support you. Maybe even enlist some professors, and if there's disability studies departments, like those people are probably game to help you too. So I'm going to move on to a question we got in the Q&A as well that relates more closely with our research and the things that we're trying to achieve going forward. And it's as follows. A gap in knowledge translation is often between the latest research and clinical practice. I'd love to hear all your partnerships with researchers. How do you partner with or plan to partner with health practitioners to improve knowledge translation?
Yeah, I mean, this is a great question. It's actually, in my opinion, what knowledge translation is all about. right? A 15-person organization cannot translate knowledge through the US healthcare system. And that's, not an acknowledgement of weakness, that's an acknowledgement of the way the system works. And so our intention is to work through partnerships with some of the other great research and implementation organizations, both in the United States and abroad, and to utilize the scientific expertise that we've developed through our scientific advisory board, through our partnerships in Australia, and through our partnerships in the United States to make sure that not only is this knowledge translation happening once, but that it's an ongoing process, that it's multifaceted, that it's both coming from a push methodology where you train healthcare professionals in the latest techniques and technologies, but also from a pull methodology where you educate the community to be aware of the latest treatments and protocols, that people, for example, who are high-risk pregnancies are aware of the different interventions that should be available to them so they can speak with their healthcare professionals and ask for them, or at least ask about them. But also, there's no way to do this in a vacuum, solo as the Cerebral Palsy Alliance Research Foundation. And so our strength is in our partnerships, our strength is in our network, and our strength is in our researchers. And so we intend to use each and every one of those communities to make sure that the knowledge translation gets out of strictly the academic teaching hospitals or the large city hospitals and into the rural communities, lower socioeconomic status communities, and just throughout the healthcare system that we all, use regularly.
Having it be evergreen and not dependent on any one person with knowledge is incredibly important. So the more that we can make our way into the systems, the better. If someone was trained in a certain protocol and they shared that protocol throughout their whole career, but then they retired, there's going to be a dip in that knowledge in that particular institution. So we need to find ways not only to get the information to the people who are there in the first place, but to make sure it's generationally locked so that if and when they leave that space and go somewhere else, that there are still people who understand and are on board with carrying out the interventions.
And actually, that's a great point. Even in just the trip that I just had to Australia, we had conversations about some of the interventions where at a specific point in time, the rate at which it was used went down, and it coincided with a retirement at one of the major teaching hospitals. And so knowledge translation isn't a one-time thing. You need to continue to train the new professionals that are coming into the field. You need to continue to talk to the people who are patients, who are, quote unquote, consumers of the healthcare system, to make sure that they're aware of the latest and greatest technologies, treatments, protocols. And so when you get both of those things happening at once, and when you get it happening over a longer period of time, then you see those numbers gradually increase until one day we're all sitting around having this conversation, talking about a time where these interventions were not available, as if it's ancient history. And those are the conversations I'm hoping to have through this initiative, right? That we will have made something so available throughout the system that people talk about it like it's the Stone Age, when it wasn't available to everybody in any hospital, whether you be in Manhattan, where I'm sitting, or Manhattan, Kansas.
So one question that came in through the registration process, someone was saying that they were in their mid-40s and they were having trouble finding care. How does what we're doing and the expansion of what we're doing potentially help that person, whether it's in the implementation lane or something else with the research that we're funding or planning to fund?
Yeah, so I think both of those things will have an impact on that person's life. I'm going to say this from personal experience. When I was seeking treatment for Lyme disease, we used to have a phrase, Lyme literate, where we would seek out doctors that were Lyme literate, that knew the latest and greatest interventions, that had experience treating patients who had Lyme disease. we need to create a community of people who are cerebral palsy literate to make sure that the knowledge translation reaches these people so that they're aware of the treatments that they, when a patient comes to them and says, I've just moved to this area and I have CP, I've been receiving X, Y, and Z care when I lived in New York City. And now that I'm living in Wichita, Kansas, I'd like to receive the same standard of care, that they're aware of the treatment protocols, that they know about the therapies, they know about all of the different aspects of the cerebral palsy treatment plan, which in some cases, just through my conversations with people in the CP community, are just quite extensive, right? Like you mentioned before, they involve multiple specialists, they involve regular appointments at different types of doctors. In the best circumstances, those doctors would all be consulting with each other to meet the needs of their patient. And that's the world we hope to create, right? Where you won't have to select the one doctor out of 1,000 who might have a cerebral palsy patient or a few CP patients, that there will be, care available throughout the system where everybody is aware that these are the interventions that are evidence-based and data-driven, that can meet the needs of their patients, whether they're 3 and are just working on the early intervention aspect of their training, or they're 43 and want to be aware of the ways that they can age better when CP is part of their life, and make some profound differences in their medical care. And I understand how this may sound. I mean, this is a daunting challenge. This is something that I'm sure countless people have tried to take on in the past. And I'm telling you, we wouldn't be doing it if we didn't think we could make a difference. We wouldn't be doing it if we hadn't built up this scientific knowledge, these partnerships with other CP providers, with CP research organizations throughout the United States and throughout the world. And we intend to leverage those networks to make the most change that we can for the most people with cerebral palsy. And that's why I do this job every day. That's why all 15 of the people who work very, very hard at CPARF do their work every single day, because we all want to impact the CP community in this way. We're all committed to making the greatest difference for the greatest number of people. And we're going to do that without forgetting that each case of CP is just a little bit different, or in a lot of cases, a lot different. And so we need to make sure that the interventions that are specifically tailored for your case of CP are available throughout the system. They're available regardless of where you live. They're available and affordable, so you don't have to take out a second line of credit to make sure that you can afford a therapy that you need for your own healthcare.
Or a GoFundMe.
And that's the work that the Innovation and Implementation Project is geared to do, right? We're going to focus on things that are both access driven and affordable for the CP community. So like some people I know who are a part of that community don't have to crowdsource for an exo or take out loans to have their treatment protocol, right? That shouldn't be part of the American healthcare experience for anybody. And it certainly shouldn't be for anybody with CP.
So, I mean, I've said this several times, but as an adult with CP and also as your friend and as someone who's worked with this organization for 3 years, I'm really deeply motivated by all of this and energized beyond, just to know that we're taking on these challenges and understanding that we're going to do it thoughtfully and methodically, and that it takes time. I mean, there's nothing someone with CP knows more than slow and steady wins the race, or slow and unsteady, honestly, wins the race. That's the end of our Q&A. Nothing else has come through. So unless anyone has final questions, if you have final things to say, Michael, go for it. Otherwise, I'm happy to just have my concluding remarks.
Yeah, let me just say one more thing, because you brought up slow and steady. There will be research that we will fund and that are currently funding that will take years to get into practice. And we are committed to taking those years with it, to making sure that it gets there, because there are still questions that are unanswered that we absolutely need to focus attention on answering. But there are solutions that could be available today. And we have to be just as committed to making sure that those solutions are available today. And so while some of the answers that you're looking for may take years, some of the answers you're looking for may also only take minutes. And we should focus on both of those things. And so when I talk about these new efforts, I know we've said it before, we're focused on both the long term, but we're also focused on meeting the needs of the CP community today. Because as Joss asked in the first question, when she said, she does this work knowing that some of the research may not ever be available to her, right? It may be available to future generations. That's true for some of it, but you shouldn't have to wait that long for most of it. And we're committed to making sure that you don't have to wait 1 minute longer than absolutely necessary to make sure we get the scientific validation to address the needs of the entire CP community at every age and at every stage. Thanks for letting me be a part of this, Joss.
Of course. Thank you, Michael, and special thanks to everyone who submitted questions. Your curiosity and your openness will help the whole cerebral palsy community. If you'd like to learn more about CPARF's work, you can visit us at www.cparf.org. Make sure you sign up for our mailing list so you can stay up to date on everything we're doing. We'll be posting this online in case you know someone who missed the webinar or you'd like to rewatch it. Keep an eye on our social channels for the link. And thank you again for your time. Enjoy the rest of your night or day, depending on wherever you are.